Anyways, yeah, the fat, it comes sterilized. It's
Yeah, you were telling me about your success with this.
yeah, patients do well with it, and so it's very simple. And once we get the fat, it's cadaver fat, it's processed, it's sterilized, and so we just have to prepare it here and loosen it up a little bit. And the great thing about it is you can walk immediately on this. Yeah, it's essentially acting like, kind of like putting a pillow right on the inside there. So when you have areas where the bones are prominent and your fat pad is kind of worn down, you know, it can get very painful. And so opposed to doing surgery where we go in and we start shaving down the bones or we remove part of the bone, this is a good alternative. Now the patients that I've done these on, we've only had to do one so far. So there's always the possibility you may need a booster down the road, but everybody that I've done them on so far has done well with just one injection. So, and you should notice the difference immediately. All right, so after we've kind of broken that up a little bit, and I've already anesthetized this area, but this is where he was having the area of most pain. You just get it through the skin there. Doing okay? Yeah. Yeah, I've tried it with different needles, and the very first time I did it, it was a little more challenging with the small needle, so I learned it can go through the 18 gauge very fast too, so I gotta be mindful of that. So I'm trying to move it around. And kind of where that dot is here is where he was having the most pain, so that's kind of what I'm targeting. I'm gonna put a Band-Aid on it just since there's a little puncture there. I take it easy today, maybe ice your foot a little bit.